All right, standard precautions are in place. We're going to apply high flow oxygen to our patient, and then we're going to check our patient's vital signs. Okay, close your eyes for me, please. All right, look straight ahead. I'm going to open each of your eyes one at a time and shine a bright light in there. Okay, that's good. I'm going to check the patient's core temperature, which is cool and moist. Now, I believe and suspect that this patient may be having an anaphylactic reaction, so I'm going to contact medical control for orders.
The medical director orders you to administer 0.01 milligrams per kilogram body weight of 1 to 1,000 epinephrine.
Okay, how much do you weigh, sir?
235.
Okay, so this patient is going to get 0.3 cc's of epinephrine, so I'm going to assemble all of my equipment, which would include the epinephrine, a tuberculin syringe, alcohol preps, and a Band-Aid. I'm going to check my epinephrine for the 5 rights to make sure, of course, it's the right med in date, right concentration, and so on and so forth. I'm going to make sure that I have a tuberculin syringe as opposed to an insulin syringe. And I'm next going to prep the top of my vial. I'm going to withdraw a little bit more than 0.3 cc's of air into the syringe. I'm going to pull it up to 0.4, that's arbitrary. I'm then going to pierce the vial, going only at the point where I have prepped, inject my air, and then withdraw to 0.4. This gives you a little bit more epinephrine so that you can get rid of the bubbles and get down to the correct dosage. Alright, so once I've done that, I go ahead, tap the syringe so that the air bubbles come to the top, then remove the excess air. I can go ahead and recap the needle this time because it's not contaminated, but you would never do that with a contaminated needle. Okay, so I've done all that. I'm going to explain next to the patient what's about to happen, which is, sir, we're going to administer some epinephrine. This will help you breathe and help your blood pressure get back up a little higher. We're going to shoot it into your arm, and actually we're going to inject it back here in the posterior aspect of the arm, roughly in this area. Now this injection mannequin, you can't inject it at that point, so we're going to inject it up here where you normally would inject an IM medication. Okay, so I'm next going to check my site and confirm that I can pinch up some fatty tissue. I'm going to take my alcohol prep, and in fact it's always a good idea to use a new alcohol prep for this. And I'm going to prep in a spiral motion from the point that I want to administer outward. Don't ever blow on this, don't ever wave your hand over it, just let it air dry a bit. And once it's air dried, I am going to uncap my syringe. I'm going to make sure that the bevel is pointed up toward the ceiling. I'm going to pinch up some fatty tissue. I'm going to inject, pull back to make sure that I don't get a blood return. If you do get a blood return, simply withdraw the needle, start all over. If you don't get any blood returning, go ahead and slowly inject your medication. Not super fast, but not super slow either. Roughly this rate is fine. I'm going to take my alcohol prep, cover the site, withdraw, and immediately place the used syringe in the sharps container. Never try to recap. I'm going to gently massage the site, and then I'm finally going to cover the site with a Band-Aid.